Hi again and welcome back. Today we're going to go through interpreting and reporting assessment results. So welcome to the final session on conducting individual assessments. In our last two sessions, we planned and conducted an assessment. It's time now to focus on what comes next, interpreting and reporting the results. This stage is crucial because the information you record directly affects care plans, medication reviews, and NDIS reporting. Accurate interpretation and reporting helps ensure that each person receives the right supports, thereby minimizing risks. So, what do you think makes an assessment report effective and useful? Yep, very good. Being non-judgmental and not holding any assumptions. Correct. Anything else? Perfect. Accurate documentation and interpretation of answers. Very good. So when interpreting results, you are identifying patterns or outcomes, not making assumptions. You need to ask yourself, did the customer meet the performance criteria? Have they improved, declined, or remained the same? Are there any new risks, strengths, or supports to consider? For example, last month, the customer needed full prompting for morning hygiene. Showers, for example, toileting, showers, teeth cleaning, dressing, all the ADLs. This time they completed most steps independently, with only one verbal cue required. That is a measurable improvement and should be recorded. So, just a case scenario. The usually independent customer needed assistance using utensils and became frustrated. So what could we do in this scenario? The customer's trying to eat with a knife and fork and having difficulty, not managing to get the food to their mouth. So what could we do instead? Correct, we could use different utensils, maybe a thicker handle for them to cope with or manage. Excellent, we could switch them over to finger foods and see if they were able to complete their meal with their fingers, using their fingers. So, what does this tell you about the customer's skills? Correct. The customer's skills may be deteriorating a bit, but by providing finger food, you are maintaining their pride and independence, and it avoids the customer getting frustrated. I know of a recent story of a customer, an aged care customer, who ended up in hospital having had a fall, and the hospital was not receptive to the daughter's feedback and advice, and so the customer was, instead of having finger food, the customer was labelled as requiring vitamised diet and having to be fed by a staff member. Now that took all that lady's pride and independence away from her, and she deteriorated rapidly. So we want to try and avoid that. How would you interpret this in your report? Correct. Exactly as it happened. Customer showed signs of frustration at needing assistance with utensils. Finger food was provided, maintaining their pride and independence, and avoidance of them feeling frustrated. It should also be escalated to a practice leader as it shows signs of deterioration and may need some investigation. We always need to check that there's no underlying cause for a treatable cause for the deterioration. So we need to compare findings to previous assessments or support plans. We need to look for any patterns or changes. We need to make a note of emotional or behavioural cues. We need to remain factual and professional. And we need to determine whether this was a once-off or a recurring incident. So how does recognising small progress support independence and dignity? When we recognise and record small progress, we're not only tracking change, we're empowering the person to take pride in their own growth and independence. This is at the heart of person-centred care. Now that you've, excuse me, I'm just getting over the flu. Now that you've interpreted the results, it's time to report them clearly and objectively. Make sure you use approved templates. For example, the personal support plan and the Lumery case notes, that you have completed the assessment. Record facts like customer used prompts to complete task, not customer was lazy. Submit reports promptly and securely. Discuss concerns or follow-up needs with a practice leader and refer to an allied health professional or medical professional if required. So what I'd like you to do now is rewrite the following subjective statements to make them objective. So the customer was rude and didn't try. Correct. An alternative would be customer declined to participate and expressed frustration verbally. How would you rewrite customer is unmotivated with self-care? Correct. Customer required verbal prompting and encouragement to complete hygiene tasks. I know which ones I'd prefer. Why is objectivity important in documentation? Objective notes provide a true and consistent record of events, which can be relied upon by other staff, supervisors, or health professionals. Clear, factual documentation helps ensure all team members understand the customer's needs and support requirements accurately. Records may be reviewed during audits, investigations, or NDIS compliance checks. Objective documentation provides evidence of professional conduct and decision-making. Describing behaviour factually, not emotionally, avoids negative labelling and supports a person-centred approach. Supervisors and allied health professionals rely on factual records to plan supports, assess risk, and adjust care plans. Being objective means you're communicating facts, not feelings, ensuring your documentation is fair, respectful, and useful to everyone involved in the customer's support. How can inaccurate reporting affect customer outcomes or compliance? Missing or incorrect information can lead to unsafe supports, medication errors, or inappropriate care decisions. Other staff may not have the full picture, leading to confusion, duplication of effort, or unmet needs. Inaccurate records can result in the wrong level of support being funded or delivered, affecting the customer's goals and independence. Falsified, incomplete, or biased reports can breach duty of care, privacy, and documentation requirements under the NDIS practice standards and organisational policy. I recently heard of an incident where a customer had become distressed and was self-harming by smacking her ear to the point where she had not only cauliflower ear, but she also had some scratch marks and open wounds around the ear as well. Now, the incident snowballed because it was not actually reported as a Riskman incident. Yes, extremely severe incident. So that was a case of not reporting an incident that should have been reported. If incidents occur, inaccurate notes may not support the organisation's position or demonstrate that appropriate care was provided, and in this situation, appropriate care was not provided because no one was aware of the incident. So, inaccurate, customer's medication administered as usual, but dose time was missed. Accurate way to describe it is customer's 8 a.m. medication was administered at 8:30 a.m. due to late wake-up. Perfect. See the difference? Okay, so just to conclude, interpreting and reporting results is the stage where your professionalism really shows. Accurate, objective documentation supports quality care, compliance, and trust. How does your documentation support person-centred care? What could happen if results are incomplete or subjective? And how will you apply these skills in your next shift? These are the 3 questions I want you to think about when you leave here today. So, accurate, timely, reporting protects our customers, protects your team, and protects your organisation. Every note you record becomes part of the evidence that quality, safe, person-centred support was provided. For example, when you're doing a diabetes support plan, you want to discuss it with the customer, how frequently they are monitoring their blood glucose, whether that's even needed anymore with the HbA1c test being available now. So these sorts of things you will work through with your customer, and when you go back and show them the diabetes support plan at the end of the session and after you've compiled the assessment, then you must get the customer's signature as on the document to show that the customer was involved in the assessment. So that's all from me today. Thank you for completing all the 3 sessions. By preparing well, conducting respectfully, and reporting accurately, you are ensuring assessments lead to meaningful, person-centred outcomes. I hope these sessions have been of help to you and that you now feel confident to go and do some really great assessing. Thanks for coming.